Hello friends, have you recently undergone a dental filling in your tooth and it has suddenly started showing up a lot of sensitivity, or there is a little bit of pain that you're suffering from, and you're worried that the dentist has done the right procedure or no, or was there something missing out? Has something happened to the tooth? Oh my god, there's so much stress related to it, and you're finding a solution for what and how can this sensitivity or pain be treated. So come friends, in today's video we are going to watch on how to deal with this problem. Come, let us have a look at this video.
Subscribe to my channel Dr. Mansi Shah.
Hello and a very happy morning to all of you, and here you are on my show Monday Mornings with Mansi and my YouTube channel Dr. Mansi Shah. So friends, before we begin, let us first know that what and when is this filling done. So what is a filling? A filling is nothing but a cement or a material which is filled up in your tooth. And why is this filled up? Because you might be suffering from a cavity. So whenever a dentist cleans up a cavity, a decay in your tooth, then that it creates some amount of hole in your tooth, and this hole is to be filled up with something, of course, because we cannot leave it as an empty space there. So that material which is filled in is called as a filling. Now there are various filling materials like amalgam, composites, GICs. Now today we are going to speak specifically about this composites, which is a polymer. Yes. So first let me tell you that when is this filling done? The filling is only done when your cavity is in the enamel and the dentine, the first two layers. Whenever a cavity is in this first two layers, the enamel and the dentine, as you can see it in the picture, then and then only we can do a filling. If it enters into the third layer, that is the pulp, where all the nerves and the blood vessels are present, then we have to undergo a treatment called as root canal. Yes. So now, when your dentist has drilled all this and he is filled up, you come back home and you are like, oh my god, this is paining. That is what your reaction is? Okay, so don't you worry. Let us first know why has this been happening. So there might be a number of reasons on why there has been this happening. So first reason is that you have visited a dentist. He has numbed the tooth which has been filled. Many dentists do numb it. In many practices, numbing is without, fillings can happen without a numb injection also. So, your dentist has probably numbed the tooth by giving a local anesthesia, and you come back home and you start some pain because the nerve there, the tooth there has started regaining its consciousness. So this pain might just subside within 24 to 48 hours. You don't have to worry about it. The next reason can be that there is some high point. The tooth which has been filled is a bit taller. That is, your teeth clench up in a pattern. Now if there is even a small stone piece, how do you feel that there is a difference? So in a similar way, this taller tooth might just feel. And if you tend to bite in with a greater pressure, the pain will increase. Now what is the solution for this? Just go to... Okay. So this can be one of the reasons where the bite has not been properly corrected, and you have to revisit your dentist to check on the bite, because you cannot just keep on biting and do not expect that it will just, wear off and be level up by just giving a pressure up there. So don't do that please, because that will fracture the filling also, and there are chances that it might fracture the tooth also. So if you have such kind of high filling or filling which is taller than your other teeth, you need to revisit your dentist and get it treated, because it is just a minor 5 minutes procedure. So don't worry that you won't be spending much more time in the clinic again. Then the next chances is that there is pulpitis, because there has been drilling, there has been some heat generated up, and the pulp, the third layer, it has been flared, or it has started showing symptoms of inflammation. Then also this pain might exist. Or if your cavity is been digged down to, which is very much close to the pulp, then also you might have this kind of pain. Now in such cases, sometimes the dentist might give you a protective layer between your pulp and the filling, and then again. Then the fourth reason can be that there are some other surrounding teeth which are paining, and because you've just done or operated this tooth, that has been showing up and you're not able to guess on exactly where and how the pain is. Now the next can be very technically related, that a filling is done and it has gone shrinked, or the margins have been left open, and the filling has not been properly done. The environment was not proper, the tooth environment, which has to be maintained by your clinician. So many times it can be clinician's fault also, and how and what material is being used. So if none of the above reasons are present, then this can be one of the reasons, and you are free to visit some other dentist and take a second opinion related to this. Friends, remember that this kind of sensitivity, if none of the above reasons are present and you think that the technique was not right, or the polymerization shrinkage has taken place and the margins have been left open, somewhere there is a prominent sensitivity, then you should be waiting for a week or two, because many a times this sensitivity just goes off on its own. As you know that the dentist has drilled with so many instruments, with burrs and abrasives, and he's just cleaned that cavity, removed all the germs from it. So even that tooth is a little sensitive, it has become a little tender on feeling. So once that tenderness and that sensitivity goes off, then you might just feel better. So how will you feel better, or how will you understand? Just wait for a week or two and then the sensitivity should reduce. Yes, of course, if it goes on increasing, if the pain is unbearable, do make sure that you visit your dentist. Now, let us speak about what are the at-home solutions for this. What can we exactly do? Start first using a desensitizing toothpaste which will fight the sensitivity. And if there is by any chance some of the open margins, that will also be taken care of. So what is to be done? Using a desensitizing toothpaste like Colgate, then Sensodyne, Thermosil, etc. These are just a few brands that I'm naming. So this can be used and the sensitivity will reduce. When applying the sensitivity toothpaste, you have to make sure that the area which is painful, you take the toothpaste, you keep it there for a minute and then brush away the whole teeth with the same toothpaste, because the sensitive toothpaste has to act there. So make sure that you practice it this way. The second is avoiding too hot or too cold food for some time. Then the third is avoiding hard food, because many times the pressure which is your normal roti sabjis don't give, your hard food might just put on the filling, and it is a fresh filling and it takes some time to accommodate in that new place. So let us give it some time to settle down. So avoid hard food too. Why avoid cold and hot food, I said, is because if you eat too hot or too cold, there is a lot of temperature difference, and being a polymer, the material which is being used, that is composite, that polymer might just expand or contract faster. So let us give it its own time to settle down. Then if you find that there is some tallness of the tooth that is happening, or you're not able to bite down properly, then visit your dentist. Tell them that there is some amount of discomfort and you're not able to chew on that tooth properly. Once that reduction of the high point is done, you will 100% feel better. Then, as I said, giving it some time and allowing it to settle down is going to work. Till then the pain settles off there, you should start chewing on the opposite side of the jaw. Like if there's pain here, then you can start chewing and biting your food from here. I have not said that switch on the liquid diet. You have to eat all your meals, because good diet and healthy diet is also going to help it to heal. So friends, this was on how can you deal with this sensitivity and pain post a filling. Now, after doing all these remedies also, after waiting for 2 weeks long, also the pain has not reduced, do make sure that you call your dentist up, ask about what can be done, or is there a need to refill it, to recheck it. If there is, please make sure that you visit it in time. And I'm sure that your dentist will be the right person and the best person to help you out with this problem. I am Dr. Mansi Shah, a dentist from Pune, And if you are liking my videos, make sure that you like, comment and share. Subscribe to the channel Dr. Mansi Shah. If you have any issues related to your oral health, make sure that you are commenting it down here, and I will be very happy to help you all out. Also, I am practicing in Pune, the state of Maharashtra. So if you are here somewhere nearby, feel free to walk into my clinic. Till then, wishing you all a happy and a very bright smile. Stay healthy, stay happy and stay over fit. Thank you.